Bayern Munich's Jamal Musiala suffered a fibular fracture and dislocation yesterday during the Club World Cup quarterfinal against PSG. Let's break this down. We see Musiala plant that left foot here in slight plantar flexion, which leads to his body weight coming down through the ankle. This position locks the talus within the ankle mortise. You can imagine the body weight forces coming down through the tibia as the foot is in plantar flexion, and this space here, known as the ankle mortise, is decreased as it locks into place. Now you see the goalkeeper coming in from the lateral side, diving for the ball, and he inadvertently causes an external blow from that lateral side. The defender is coming in from this side while the foot is planted. This causes the leg to collapse inward, while the foot and ankle is being externally rotated in the opposite direction as it gets caught between the grass and the goalkeeper. This forced external rotation and eversion is essentially the same mechanism as a high ankle sprain. However, instead of stopping rotation here,
you can imagine the ankle continues to externally rotate to the point of breaking the bones of the ankle mortise and subsequently dislocating.
Immediately after the injury, we saw players from both teams start alerting emergency personnel that the injury was serious. And when there's concern for this, it requires full trauma protocol activation. First concern here for doctors is the blood vessels and nerves of the tibia and fibula. The trauma and soft tissue destruction can cause bleeding and swelling that can lead to increased pressure in the compartment. This is called compartment syndrome, and it can cut off blood flow to the region. The risk of limb loss is reduced with gross reduction back to its normal alignment, and getting it splinted or casted once stabilized, getting the athlete to the hospital as soon as possible. Another big concern is if this was an open fracture or a compound fracture. That's when the bone is coming out of the skin. You're pretty concerned about an infection and increased complications. This injury typically requires surgical alignment of the broken bones and stabilization with screws and plates. Data predicts an average return to play within 7 to 10 months, with a return to 90% production after about 12 months from return. But return to full production is also contingent on the amount of ligament, tendon, and cartilage damage that he may have sustained. Wishing Jamal Musiala a safe and speedy recovery.